Okay, so without further ado, let's jump into policies and guidelines. So what we're going to cover are accident and injuries, back safety, office safety, clinical and driving safety. So some of this may not always pertain to something that you're doing, but it's always important, just to, like I said, to kind of keep it at the back of your mind. So for accidents and injuries, so if you're, this is for like if you're volunteering, if you're coming to from an IPU, if you're going to the home of a patient, then you're in your car. So accident and injuries should, any accident should be reported while you're volunteering. There's an accident investigation form should that happen that you can just, once you've contacted me, is something that we can go over. And an accident would include something like a car accident, if you've tripped or fallen at an IPU or at a patient's home, if you're going to someone's home and a dog bites you, or Lord forbid that a patient or a family member bites you, absolutely report that. So if for some reason you're going into someone's home and you have to move something, you pull or twist your back, tweak it or something like that, anything you do that's related to your volunteer time, even if you think it's a minor thing, you just need to let me know. Let me or Sue know what's going on so that we can help you through that. No one is permitted to volunteer at any time under the influence of drugs or alcohol. If you're taking medication for an illness, that's one thing. It's no one will willingly be permitted to volunteer while their alertness is impaired. So if you're fatigued, if you are sick, if you're taking medications that are causing you to be sleepy or a little dizzy, you probably should let one of us, Sue or I, know so that we can, it would probably not benefit you or the patient or family to volunteer that at that time. Back safety. I think most people, especially if you have back issues, know about lifting heavy objects and making transfers. Technically, we're not transferring, we are not hands-on with our patients. But just to reiterate, you want to evaluate the safest way to move a person or an object. Be sure that it's not too heavy, and call if you're in doubt, or if you're at a patient's home and someone falls, if someone is not immediately available to lift that person, you can of course let me know something, and if it is an immediate thing, then it is and please feel free, David or Ryan, to correct me on this if I'm incorrect, but you can call 911 to have them send someone to help you lift or help that person be lifted if it's an immediate danger for that person. Always lift with your objects with your leg muscles, not your back. Don't bend over. Keep the weight close to your body. And I'm a very handsy person, so I'm going to be wiggling a lot. Don't twist while you're lifting, and when possible, push instead of pulling an object. Just be real mindful of using your legs as opposed to using your back. When you're in the office, these are like common sense rules. Horseplay or scuffling, you just probably need to be a little mindful of where you're at. Open the door slowly, which is something I have to be mindful of. I'm one that will fly in a door or around a corner, so you need to be mindful of your speed when you're in a building. When you're entering or exiting the building after hours, ensure that the door does close completely. Anytime that you might be at one of the IPUs at the house or the home, just make sure that those doors do lock. I know here at the house they do for sure. I'm pretty sure they do at the home after a certain time. Make sure those doors shut. All outside doors other than the front door are to remain locked at all times. Firearms or other dangerous weapons are not to be brought on campus. Do not tamper with a machine that is not within your scope of duty. So if there's problems with the phones, perhaps you don't need to go to the room and play with wires. That one of us know. If you see a potentially hazardous condition, if there's wires or clutter on the floor, please let somebody know that so that we can make sure that gets remedied. For clinical safety, make sure that the patient or family know that you're always coming to visit. It's always good to give the family heads up if you're doing a home visit, just so that they're mindful and they know that you are. Sometimes patients may live alone, so they just need to be knowing, they need to be aware that you're coming. Keep valuables locked in your trunk. Don't wear excessive jewelry. Be aware of your surroundings. All those are important. And if you ever feel unsafe about where a patient lives, just to discuss this with your discuss it with Sewer Eye. Do know that our social workers always try to be mindful of our volunteers going out, so they try to give us as much information as possible about location, and if there may be any issues that you might come in contact with. If you get to a home or if you're driving through a neighborhood, or if you're driving down a country road because you're in the country and you're a little nervous, don't hesitate to give a call, and let us kind of know what's going on. If there is violence during a patient visit, leave immediately. You leave immediately. You need to get to a safe place and call, depending on the situation, call the police, call our office if it's an after hours, call one of us immediately. Just call the office immediately, and they'll get us in contact with, or you in contact with, who you need to speak with. Actions occurred and to be taken in the future will be noted in a patient's file. So if you're at a patient's house and for whatever reason family members start to squabble and it gets to be a rough and tumble, you just need to go ahead and leave at that point and let us know, and then we can handle it from there. Driving safety. Now, this is something we all learned in driver's ed, but we are going to go over this because some of us have been out of driver's ed a while and probably need a little reminder. Number one, always wear your seatbelt. Number two is follow the speed limit and all other traffic rules. And I will leave it at that. Follow the speed limit and all traffic rules. Make allowances for lack of skill or knowledge on the part of other drivers. We do have a lot of new drivers that may not know the roads yet. So try to always be mindful of drive defensively, I think is what it is. So recognize that you have no control of other drivers' actions, or pedestrians for that matter. Keep your car in good working order and report any auto accidents, which is you would call 911 to notify the police and EMS if necessary. Then you want to notify Sewer Eye, and then you will complete an accident investigation and incident report at that point. But the main thing is that you call 911, you get the help that you need, and then let us know as soon as possible. Distractive driving policy. Now I will read this word for word because this is for all of us. Our employees are prohibited from texting, and half of this is not on here. So make any use of electronic mail functions or talking on a handheld cell phone while driving for company-related business. This includes, but is not limited to, answering or making phone calls, engaging in phone conversations. I think that's what that says. Reading or responding to emails and text messages. Reading and responding to text messages is huge. Don't take it is very important that you keep your eyes at all times on the road. So if you can be mindful and not answer that phone or not, then definitely maybe put your phone in your pocketbook, in your pocket, or whatever. So, and I covered a lot, and I will be going fast. So if you have a question or need to stop me, please let Ryan or Sue know or something so that we can stop where I'm at. Okay, so the next section is emergency preparedness. And this will include disaster planning and hazardous communication. And this may not seem like it's something that really addresses you as a volunteer when you're going into someone's home, but these are all mindful things. And if you are ever in our office or in one of the hospice home or the hospice house, these are things that you would want to kind of know. So disaster planning. Medicare conditions of participation require all Medicare and Medicaid participating providers to create an emergency plan, a disaster policies and procedures, and a communication plan for an ongoing training and testing purposes. So our disaster plan should include an internal and an external plan. Okay. So for an external, the things that would be external would be your tornadoes, hurricanes, snowstorms, pandemic, that's new, civil unrest, flooding, and any kind of chemical or industrial accident. Your internal disaster plan would include a fire, a bomb threat, any kind of loss of electrical or phone systems, any kind of an industrial chemical accident, or just short staffing due to a flu or, in our current situation, a pandemic. So the preparedness part of the disaster planning would be for patients and caregivers will be given instructions on disaster planning beginning on the day of admission. So that's something that families will already have an idea of, that the nurses, the people that have gone before you have already given that to people that are in homes. The information is in the patient resource and care guide. Members of the organization's management team and any others having specific assignments will have a copy of the disaster plan. So if you're at a home, or if you're in the office here or in one of the other IPU units, there is a plan, and everyone that's there should have an idea of where and when to go on that plan, and it can show you where that plan is. Staff complete disaster drills annually, and patients are given a priority level based on medical condition or care situation. And that's very, very important, especially if you have a fire drill while you are visiting or volunteering at the house or the home. For the external disaster plan, the agency disaster plan will take effect in the event of an emergency that would result in the interruption of patient services. When you're internally, if a employee or a volunteer become aware of a problem requiring immediate evacuation, if you hear a fire buzzer going off, or you know that there's a tornado coming that requires an evacuation of the building, they should notify staff over the intercom system, or let someone know that has that ability that there's a fire to evacuate the building. Emergency building exits will be clearly identified. You'll know where they are. And staff and volunteers immediately would proceed to the nearest doorway and exit the building. Staff and volunteers should meet at the end. Well, this is, this says at the end of the parking lot at Westchester Drive, but if you're in Asheboro, that's a pretty far distance. So the point for that would be is, if you are in the building here, exit and follow where everyone that is an employee knows where to go. And if there's any questions, we'll help you with that, but that's definitely follow the same things at either house or home. So for hazard, another one is your chemicals. So all chemicals, I will say, on this one, the chemicals are not anything that's normally kept in they're kept in original containers. They follow SDS guidelines and systems. These aren't anything that you will normally come into contact with, but in case you have an exposure, you just need to notify the supervisor or notify one of us that you've come into, you've been exposed to something. infection control. This is going to be more close to things that may relate to our volunteers. So on this section, hold on, I'm reading it off the paper and not going forward. There we go. So for an employee and volunteer health surroundings, the things that we need to be aware of are TB, influenza, norovirus, MRSA, and the new one would be the coronavirus. So those things will be addressed in this next section. The infection control policy is, most of this is pretty common sense type things. And so I'm going to probably go through this pretty quickly. If there's any questions, like I said, please feel free to let Sue or Ryan know. But patient infections are selected for surveillance based on factors that include frequency, potential for adverse patient outcomes, or potential for prevention. So the nurses add patient infections except those present at the time of admission to the electronic medical record. So if there's something additionally, they let the team know that there's something else going on. Our VP of Quality and Compliance reviews the infection data to identify trends and need for changes in infection control policies or procedures and reports this to their committee. Prevention measures outlined in this policy include standard and universal precautions, bloodborne pathogen exposure plan, personal protective equipment, disinfecting of equipment, and hand washing, which is before, and you'll see this hand washing several times. And again, this is kind of the dry part of this presentation, but this one's important, is to make sure you wash your hands before and after patient contact, or after removing gloves, with alcohol-based hand gel or soap and water. Either one is acceptable. And always use soap and water if hands are visibly soiled, which I guess if you fell walking into a patient's home in the mud, then that's visibly soiled. Otherwise, it should not be an issue. So employee and volunteer health. Any employee or volunteer who has been diagnosed with an infectious or communicable disease will be relieved of duties. And that just means that you're not going to be able to work if you've been told that you have the flu, or you have the coronavirus, or you have something that could be communicable to other people. Once you've completed the medication or whatever it is to get, or once you've are over that virus or whatever it was that you had, then you can report back to duties. So one of the things that we, and again, this is something that we just need you to be mindful of or aware of, but as part of our policies and guidelines, is tuberculosis. So what is tuberculosis? It's a bacterial infection caused by Mycobacterium tuberculosis. Most commonly, it's found in the lungs, but it can attack other organs. It's not successfully treated. If not successfully treated, it can be fatal. And there are two forms, which would be your latent and your active form of TB, tuberculosis TB. If a person has a latent form of this, that means they've been infected, but their immune system's able to fight the bacteria and stop it from growing in the body. They don't feel sick, they can't spread the TB infection, usually has a positive test or a blood test, has normal chest x-ray, and may later develop active TB. If the person has active TB, then they are that means they've been infected, their immune system is not fighting it off, they usually have some sort of symptoms, they can at that time spread TB, and they usually have a positive test for it or a positive blood test, and they have an abnormal chest x-ray. So this is what you all did yesterday with your TB. This is why we do our TB testing, because it can be a very contagious type of thing. So tomorrow, you'll have your arms read, and the nurse will tell you at that point what's going on. How to spread TB. If a person is active, has an active lung infection, they put the bacteria into the air by coughing, sneezing, or even talking. Anyone that's close by breathes that bacteria in and can become infected with it. With the masks that we're wearing right now, I'm not going to, let me just step back from that because that I don't have information for. Symptoms of active TB is a bad cough that lasts for longer than 3 weeks, pain in your chest, coughing up blood, you're weak and fatigued, you may lose weight, you may not have an appetite, there may be chills, fever, and sweating at night. These can follow along with other viruses as well. So the cough being very telling. So the treatments for tuberculosis are antibiotics, and they usually take 6 to 9 months to complete the course. So that's a long course of antibiotics. Our organization, which is why our organization annually conduct TB risk assessments. We all have to do this on an annual basis. And that is, we're administered the TB skin test, which is what you all had yesterday. And then it is read within a 48-hour period. Now, influenza or the flu is a respiratory illness caused by a virus, and it normally occurs, we're getting ready to go right into flu season on top of everything else, is October through May. And a lot of new cases for the flu normally occur in January and February. So symptoms of the flu normally, normally include fever and feeling feverish. And some cases of the flu, you don't even show a fever. But a lot of times you'll have a cough, you'll sore throat, runny or stuffy nose, your body aches, you have a headache, you're very tired, and sometimes there is vomiting and diarrhea, which is more common in children. It is spread person to person, and it's usually done through the sneezes, coughs, and talking. It's like most viruses, it's normally airborne. The person-to-person spread of the flu if someone with the flu were to touch a surface or object that has the flu virus on it, and then touch their mouth or their nose, that's one way that you could also bring the flu virus into your body. So to prevent this, again, you want to wash your hands often with soap and water or some sort of alcohol-based hand sanitizer, which we have in abundance, thankfully. You also want to not share items. So if you have been around someone that may have given you, had utensils, you've ate with someone and you share a fork, there's a possibility that you could catch that virus from just doing something simple like that. Everyday tips to prevent this, okay? And this is going to be, again, your common sense things. If you sneeze or cough, if you don't have a tissue, go ahead and do this into your elbow. Wash your hands often, soap and water. Try to avoid touching your eyes, nose, and mouth. And I will be honest with you, when you tell me not to touch my eyes, nose, and mouth, the first thing I want to do is rub my nose or touch my eyes. It's very, very common to want to do those things, but we have to try and be mindful of where our hands goes. Also, avoid, if you can, close contact with anyone that you know that is sick. So how long should you stay out of volunteering or work for that matter? So we go by the CDC guidelines, which is that you should stay home while except for when you are going to seek treatment for it. And that means staying home from all activities. So if you know that you've got the flu and you've gone to the doctor and they say you have the flu, that means don't come to the office or don't volunteer because you don't necessarily feel really, really bad with it. So they want you to stay home from all activities. Please let one of us know, Sue or I or Ryan, or know that you are experiencing this, and so that we can take the appropriate procedures from there. You need to remain at home for at least 24 hours after your fever is gone. So that means without taking any sort of Tylenol or medication, you need to be 24 hours free from a fever before you can call us back and tell us that you've been fever free for 24 hours. You're ready to go back into doing your volunteer services. So vaccinations. CDC recommends a yearly flu vaccine for everyone over the age of 6 months, unless they have a specific contradiction. Now, the norovirus is highly contagious. It causes gastrointestinal issues. This is usually your vomiting, diarrhea, and dehydration. This is usually when you're really tummy sick. And it can stay alive on objects and surfaces for days to weeks. The spread of the norovirus is eating food or drinking fluids that are contaminated with the virus, touching any sort of contaminated surface or objects and putting your fingers in your mouth. Again, one of those things you have to be mindful of. And close personal contact with, obviously, with an infected person if you know that they're infected. Or 5 tips to prevent the spread of the norovirus is, again, wash your hands, wash your hands, wash your hands, especially after toileting, changing diapers before you're eating or handling food. That's real important. Be sure to wash your fruits and vegetables and cook your seafood thoroughly. That's a good place to get this from. When you're sick, don't cook for others for at least 3 days, like if you definitely have the tummy virus or the norovirus. Clean and disinfect potentially contaminated surfaces with chlorine. Wash your laundry thoroughly. So immediately remove and launder any kind of clothing that may be contaminated from the norovirus. So if that's pretty self-explanatory. I guess I won't draw a picture with that one. Wear your gloves when you're handling anything afterwards so that you don't go to wash it and then pick something else up and then you may have picked it back up again. So then, have I lost? I can't see everyone, so I'm going to hope that you're all still awake. I see 3 people. That's it. So as long as no one's fallen out, I'll let someone else. Okay, so we're more than halfway finished. So real quick, so the MRSA virus. This is a staph infection or a staph bacteria which is resistant to antibiotics. This is a pretty serious kind of infection. It's a skin infections are the most common form of the MRSA. They may appear as little pustules or boils, and they might look like a little spider bite, and often occurs at a site of a trauma. So if you've cut yourself or there's a bruise or an abrasion, a lot of times that's where MRSA will find a way in. The treatment for MRSA is if you have an infection, you want to cover the area, wash your hands, and contact a healthcare provider. Now, the new one on this one is you want to cover that area and contact a healthcare provider. Don't attempt to treat a suspected MRSA on your own. This includes popping or draining or applying a disinfectant or an antibiotic ointment, because this tends to, it can definitely worsen it if you try to do that. If you're given an antibiotic, you need to complete the entire thing. Even if you start to feel better, you need to complete your entire dose. If the infection does not seem to be getting any better within a few days of starting your treatment, then you definitely need to contact your healthcare provider again. Some of the precautions for spreading this is your standard wash your hands, patient education, so you're educated on what the MRSA is and how it spreads. Visitors should always follow any sort of facility visitor policies. They should avoid touching any sort of catheter, wound sites, and wash their hand before leaving a room. Now, you shouldn't be touching any catheters or any wounds, but that's just something to be mindful if you happen to have a family member that is using any of those things. And this one is, I'm going to run through this one, and then right when I finish the coronavirus, because this one's really new. Ryan's going to talk for a minute when I finish this part of the session. So the coronavirus, COVID-19, it's the one that has everybody in that place where they say 2020. Instead of saying anything else, you say 2020 because that's the year of the coronavirus. So the coronavirus, for those that may not have heard this, is highly contagious. Symptoms reported range from mild to severe. They may appear within 2 to 14 days after exposure. And people with these symptoms may have some of the following. And again, these are going to sound familiar. Fevers, chills, cough, shortness of breath, difficulty breathing. You're fatigued, you ache, you have a headache. You might notice a loss of taste or smell. You may notice a sore throat. You may have congestion or a runny nose. You may have nausea or vomiting or diarrhea. You may have some, all, or none of these symptoms. Anyone can have mild to severe symptoms. However, and I think this is something that's definitely been something to be mindful of, is that the older adults seem to have who have a severe underlying medical condition, like, I don't even know, heart or lung diseases or diabetes seem to have a higher risk for developing a more serious complication from the COVID-19 illness. They have said that the COVID virus can spread person to person, and it can also spread person to object to person. So it's like most of the other things with the viruses, it can be spread by contact or person to person. A community spread means that people have been infected with the virus in an area, including, I don't know what that word is, including something that are not sure how or where they became infected. Including some that are not sure how or where they became infected. Okay. There's currently no vaccine present for the coronavirus. The best way to prevent illness is to avoid being exposed. And then there's 6 tips that we have right now for this particular virus. Wash your hands, soap and water, hand sanitizer, social distancing. You probably be the one word you will never forget from 2020 will be social distancing. It'll be forever in our vocabulary, and hopefully when this is over, we will never want to hear that particular word, 2 words again. But social distancing, which means try to put a minimum of 6 feet between you and another person. Here's another one, a cloth mask to cover your mouth and your nose, and cover your coughs and your sneezes with a tissue or your elbow. Clean and disinfect frequently, touch surfaces, and monitor your health daily. So I think I'll let you address this next one. I mean, as far as the monitoring the health daily, you can address that, Ryan. Okay, you ready?
Sure.
Yeah.
Sure. So for you personally, to monitor your own health daily, we're looking for all of our volunteers, once they are approved and kind of in our system, will receive a daily text message to a screening that they'll complete. You do not need to complete the screening daily, and we are only asking you to complete it on the day that you are volunteering with us. So every other day you can just delete it immediately. But that screening just has a few questions asking you for your, if you're experiencing any symptoms, have you been around anybody who has experienced the symptoms or been diagnosed with COVID-19. The purpose for that is that, one, before you show up to either administrative building, a patient's home, or an inpatient, one of our IPUs, that you are clear to go, because all of our staff that go into those buildings are all submitting really the identical screener questions. And as people come in to visit patients, we are asking them to screen at the door. We even, when you walk through the door, their fever is tested at their temperatures taken over at the High Point home, and I believe at the Hospice
It is.
House of
Yes,
Randolph
they
as
have it
well.
here.
So the screener questions are for your good, as well as the protection of the patient's families that we're working with, as well as the staff that you work alongside. If you're assigned a patient, we are asking you to make a phone call to kind of set up your initial visit, which is true to our experience pre-COVID. But the new adaptation and policy in place because of kind of our new norm for the time being will be that in that phone call, you'll also do a assessment of the patient and their family. And so if the visit is scheduled for that day, you'd go through these several, let's see, I can actually read them to you. A couple questions that just over the phone, you'll ask about their exposure, about their travel, and about their own current symptoms. And so if I won't bother reading them because that's really the highlights. But
And
if
they
you
will get that,
can
and they
respond to
will
all
get that
three of
information.
those as negative, then you will capture that in the log that you submit that day. But you also kind of have the peace of mind going into that visit that hey, I'm symptom-free, they're symptom-free, and that's as good as we can do to take the precautions. It's the same precautions that we are advising our nursing staff to take, our social workers or chaplains as they go in to perform a visit. We will knowingly not send a volunteer into a home where there has been a positive test or a positive exposure. And if that information hasn't come our way yet, but you're making that initial phone call and you hear, oh, actually, yeah, grandma just had or cousin just had, and they're all living in the same home, then you will have the opportunity to say, okay, we'll have to postpone this visit.
Yes.
You'll hear from a social worker for more details because you might hear that a patient has been exposed before even a nurse does because our volunteers are having the opportunity to be a part of the team again and go into their homes. And so we are also asking volunteers when they go to a home to plan on wearing a mask. That's the same for our volunteers at our inpatient facilities and our volunteers at in our administrative offices. You see right now I'm not wearing a mask, but I'm alone in my office. If you are in a public place or in the halls, we ask our staff and volunteers to wear a mask. If you're in a space where you have the opportunity to socially distance, or you're in a break room where there's, plenty of room for multiple people to feel comfortable.
Have 6 feet.
You can remove the mask at that time. Or if you're uncomfortable with that, you could ask anybody to please keep their mask on and you want to keep, and there's no pushback because we're all very aware of the sensitivities of individuals and we're very respectful of honoring other people's wishes. If you're in a home, in that initial phone call, and you're doing the assessment, you could also ask the family, the caregivers, to wear a mask while you're there. They may not do so naturally or by themselves, but because we're asking that of you, we are giving you the autonomy to ask that of patients and families. Now, if a patient has a respiratory illness and a mask is not appropriate for them, you're going to be maintaining social distance anyway. And so we believe that you're still taking the ample precautions and we're setting you up for success. Again, we're not knowingly sending a volunteer into any circumstance where we wouldn't send any other member of our staff or clinical team. Before Dawn continues, does anybody have any questions about any of these current policies, procedures, precautions. I know it's a lot, and tomorrow, if you have a question, you can ask it in person, but great. Appreciate.
I have a question. Do you have, what are the numbers of cases in the High Point, in the Piedmont home now and in the Randolph home? And have you had issues with COVID-19 at either of the facilities with staff? Is that private, or can I ask that?
I will allow David to speak to the Randolph branch, but I know that the hospice home of High Point does not have any positive patients. There is not a wing of the building that's will allow for positive patients. And I am not personally familiar with any staff over at the hospice home of High Point that have had a positive exposure, despite their many interactions with the public and patients. David?
Right, that's good to hear. I think we all are, worried, and I think it just makes me feel better, but I'll continue to put out good thoughts for, everyone. And yes, David, if you have anything to follow up, that'd be appreciated.
Yes, we do have a special wing at the Randolph Hospice House that is designated for COVID patients from both campuses if that is needed. It's isolated. It's like a quarantine section. You have to go through a special door and wall to get into that section of the wing. Back early on in the pandemic, we did have a couple of patients that did have COVID-19. They have since passed, not from COVID-19, but from their original illness that they were on the hospice service for.
Right.
But we were very fortunate to have the way our house is designed separately from the hospice home here in High Point. We had a section of a wing where specific rooms and even an annex nurses station could be quarantined off, so there was no cross-contamination for staff, volunteers, or for anyone. So we put those protocols in place. To my knowledge, right now, we do not have any patients that are positive. Again, early on, we had one or two staff members at the hospice house in Ashboro that did test positive. And again, they were, when that was found out, they were quarantined and they had to stay at home for at least 2 weeks until they had another test and were found to be clear of the virus. None of them were ever very sick. The ones that tested positive, I think they did it as a safety precaution because they had some mild symptoms of it. And that probably came from their families, because it's hard. We can be as careful as we can possibly be in our offices and in our facilities. But all of us, when you go home at the end of the day, if you stop by the drugstore to pick up something, if you run in the grocery store to pick up something, or if you're in close distance with other family members and whoever they might have been in contact with, it puts you at risk. So that goes back to what Ryan and Dawn were both saying. It's very important to wear a mask, to wash your hands continuously. And I can use myself as an example. I had a scare this past weekend because I went to a small group chamber meeting of an area chamber of commerce last Thursday. And there was only 7 of us in the meeting. We were socially distanced and wore masks, but we found out that one of the members that was there at that meeting, Friday, he tested positive for COVID-19. So they alerted the rest of us. I immediately went over the weekend and got tested, and I self-quarantined myself Friday through yesterday, as a matter of fact, with no outside contact until I got my results back yesterday. that it was negative. So I was very relieved. I never had,
Yes.
I was checking my temperature constantly and I didn't have any symptoms. But there again, just something as simple as being in the same room with someone else that tested positive. Come to find out, he got it from going to a choir practice at his church. And I since learned this morning that so far 5 members of their choir have tested positive for it. So, be very careful when you're out in the public. I'm very self-conscious. My wife and I are both in healthcare. She does physical therapy. So we're both involved with the public every day. And I told my wife, I said, I'm not as worried about myself getting the virus as far as fighting it off and recovering from it as I am worried about the domino effect that it would have for everyone around me and everyone that I'm in contact with. So you do have to remain self-conscious and be very mindful of that.
Yes, thank you for taking the protocols that you all are taking, and I'll continue just to put out good thoughts to all of you and to all of the patients. Thanks, Brian, for all the info, and Dawn.
Sure. Oh, is it back to me?
Back to Dawn.
Back to you.
Okay. All right, guys. We're almost at the end of it now, and I am going to go kind of quickly through this. Because the next one is your bloodborne pathogens, which are, we'll discuss the different types and the precautions that you can take in regards to the bloodborne pathogens. So what are they? They are microorganisms present in the bloodstream, which can be transmitted through bodily fluids and cause disease in humans. What are common types of bloodborne pathogens? HIV, hepatitis B, which is most easily transmitted but preventable if staff get a series of Hep B vaccines, and hepatitis C. HIV and AIDS is I hate when this is caused by a virus. The virus affects cells of the immune system, and over time, it destroys the body's ability to fight off infections. There are different stages of HIV. It's not quite what it was in the beginning of our knowledge of this. So early stages are usually within 2 to 4 weeks. They get flu-like symptoms. They last a few days to a few weeks. There's maybe fever, swollen glands, sore throat, rash, fatigue, muscle aches and pains and headache, which sounds familiar to other things that viruses cause. Then you have what's called the clinically latency stage, which may also be considered the asymptomatic HIV infection or the chronic infection, which is the virus is living and slowly reproducing in a person's body. The person usually does not have any kind of symptoms. This may last anywhere, it lasts about 10 years in persons not getting the antiretroviral treatment. I have no idea if I said that correctly. Transmission and testing. So the disease can be transmitted during this asymptomatic stage when the infected person does not know they have the virus. And testing is really the only way to know if you have the virus at this particular stage. The development of the symptoms marked by the progression to AIDS may include the rapid weight loss. You have now got sores in your mouth, your fever is reoccurring, and you might have the really profuse sweating at night, pneumonia, extreme and unexplained tiredness. Now you're starting to have maybe brown, red, purple splotches on your skins. You have prolonged swelling of your lymph glands in the armpits, the groin, or in your neck. You may have memory loss and depression and diarrhea that lasts for more than a week. For your hepatitis B, it's a contagious liver disease caused by the Hep B virus. It may be acute or it may be a chronic infection. This particular virus can be detected by a blood test, and viruses can be transmitted through bodily fluids. So the best way to prevent a hepatitis B is to have a hepatitis B vaccine, which is a series of 3 injections over the course of 6 months. The acute Hep B symptoms usually appear within 3 months of exposure, although some infected persons may not even have any symptoms. But if they do, part of those symptoms would include your fever, you have an abdominal ache, a fatigue. Something that would be noted is your gray colored stool, loss of appetite, dark urine, nausea, joint pain, vomiting, and you might be notice a yellow coloring to your skin, and that's because this affects your liver. So for your Hep C symptoms may appear within 2 weeks to 6 months after your exposure. And again, these symptoms may include your fever, fatigue, loss of appetite, nausea, vomiting, gray color stools, joint pain, jaundice, similar things to your Hep B. Again, this does involve your liver. So 15 to 25% of the infected persons will clear the disease without any sort of treatment. So who should be tested for Hep C is anyone that might have HIV, anyone who has evidence of a liver disease, such as abnormal liver tests, and those born between 1945 and 1965, which doesn't hit very many of you guys because y'all are all pretty young. The Centers for Disease Control and the CDC recommends a one-time screening for any baby boomer. So if for some reason any of you might be born between 1945 and 1965, if you have had a one-time hepatitis B test, that will tell you that will be sufficient. Your chronic Hep C. So chronic Hep C occurs in 75 to 85% of those that are infected. And most people can be asymptomatic for really long periods of time. However, this can lead to really serious liver problems, such as damage to your liver or cirrhosis of your liver, liver failure, or even liver cancer. So how are the bloodborne pathogens spread? So you can spread this, can be spread from an infected person to a healthcare worker. So this is why this is something that's important to any of our healthcare workers or nurses, CNAs. Each of the following 3 things must be present. So all 3 of these must be present. The bloodborne pathogen must be present to start with. So the person infected must have the microorganism. It has to have a mode of transportation. So that means that the organism has to leave the infected person by some means. And there has to be a mode of entry. So this organism has to be able to enter the healthcare worker's body by some means. So what type of mode of transportation to get from the infected person to the healthcare worker would be through blood or bodily fluids, through secretions, any kind of excretions except for sweat, a non-intact skin. So if there is an injury to the infected person and the healthcare worker has an injury or a cut, it can be transmitted that way. Are the mucosous membranes. So anything that is fluid related, or if you have an injury that has an opening for the microorganism to come into. That's how the bloodborne pathogens are spread. We don't always know if a person is infected, so treat everyone as though he or she is infected. Since most of you will not have hands-on with any of our patients or their family members, this is something to be mindful of, keep it in the back of your mind. But this is something so that you understand how this can be transmitted. Your universal precautions is a prevention strategy in which all blood and other potential infectious materials are treated as if they're infectious. So anytime if you were to be near someone that may have an open wound, gloves. You just want to make sure that there's some sort of protection, some sort of barrier, so that there's no mode of transportation of the bloodborne pathogen. Your PPE, or your personal protective equipment. I know you've heard that since the pandemic has become something that is, PPEs are very commonly heard now. So what does a PPE include is, these are, and also your protective equipment is provided at no cost to employees and volunteers. There are gloves, eye protection, face masks, and gowns that are included in that. Not all of those are something that you would require or need, but those are things that can be provided to you. The selection of PPE is going to be based on the nature of the patient and the interaction and the potential for exposure to blood, bodily fluids, or infectious agents. Never wear the same PPE for different visits. So if you're visiting if you're visiting 2 patients in one day, you want to try to wear 2 different masks if that's what you're doing. If you have any questions, any concerns, any need to report anything, you need to contact your volunteer coordinator. Let Sue or Ryan know that you may have come in contact with someone that could be infected, so that we can handle it from here and let the appropriate people know.